Health and Psychological Trust Center, Project pinkblue, has raised alarm on the astronomical cost of cancer medication in Nigeria and urges the federal government to establish national cancer screening centers and increase allocation to Cancer Health Fund both at federal and state levels to support patients of heavy financial burden. Farida Banwu, the program associate of Project pinkblue, said commemorating the 2026 World Cancer Day themed United by Unique to spotlight the salient unique issues faced by Nigerian cancer patients between feeding and purchasing their medications. He disclosed that Nigeria is now one of the worst countries to be diagnosed with cancer, as many cancer patients cannot access the care that they need. According to her, in Nigeria, about 127,763 new cases of cancer and 79,542 deaths were recorded in 2022. About 62% of Nigerians diagnosed with cancer died of the disease. This means roughly 62 out of every 100 Nigerians diagnosed with cancer in 2022 died from the disease. The deaths are happening because of multiple system barriers in our healthcare, including late detection, poor survivorship, poor access to travel, a limited oncology workforce, and poverty.
We are here to show that every cancer journey is different. Every cancer case, every journey, every path that they take from the beginning of their diagnosis is different. But at the same time, with how it is different is how in Nigeria, yeah, it's very difficult to really battle cancer to the core, because cancer patients have to determine, do they want to buy food or do they want to buy medication.
Survivors and other stakeholders at the event called for more advocacy and sensitization, both from civil society organizations, spiritual leaders, and made a call to end stigmatization amongst citizens who have been diagnosed of the disease, as early detection is paramount to reducing mortality rates in Nigeria.
To help the knowledge for people that a cancer exists, unfortunately, and we try to beat it on a daily basis.
I've been in the shoes, I've gone through the treatment, I know what it takes, I know all the pains and the situation that comes with having cancer, especially mine that is colon, and to God be the glory, I've gone through the treatment because mine was detected almost early enough that I had to take the quickest measures immediately to start the treatment to avert any mortality rate and all that.
I was diagnosed in March 2017. I've undergone many rounds of chemotherapy. In fact, I'm still on active treatment because I had a relapse. I've done so many, so up to 9 surgeries. It's not an easy journey, but you have to believe in yourself. Cancer attacks the body, attacks the mind. So we should not always focus on treating the body. We can always focus on treating the mind of the person through psychological support.
Every cancer journey is different. From diagnosis to treatment, every individuals diagnosed of cancer have a story to tell. However, many contemplate between feeding and affordability of treatments, and in view of this, the Nigerian government must ensure patients diagnosed with cancer must have access to quality treatment through government intervention of affordable medication and through medical intervention.